A live look at San Francisco and an idea that at first may seem a little strange. There's a bill on the governor's desk that would actually pay drug addicts to sober up. KPIX 5 reporter Kenny Choi is live with the study that says it just might work. Kenny?
Liz, opponents are saying that this would be a waste of taxpayer dollars as lawmakers try to make California the first in this country to pay addicts to get clean. They're taking a radically different approach to address drug addiction. The growing methamphetamine crisis has led to the majority of overdose deaths in San Francisco in recent years.
Right now, we're doing really close to nothing in regards to the meth crisis and the drug crisis and the overdose crisis that's afflicting our city.
Contingency management programs would allow addicts to get a payment as incentive for each negative test. And after several months of treatment, that could total hundreds of dollars.
We know that meth does not have a pharmaceutical treatment to help people get into recovery, like, for example, opioids has their medications you can take. That doesn't exist yet for meth.
City Hall and any of the legislatures that represent us in Sacramento seem to focus on how to spend money on programs that we know are going to fail.
The California Health Benefits Review Program, which independently analyzes proposals in the state legislature, say there's clear and convincing evidence that contingency management programs work.
Incremental rewards for somebody who was a stimulant user is an effective treatment.
But the same research also shows the effect doesn't last beyond 6 months after treatment ends. Tom Wolf is a recovering addict who believes there has to be more of a balance of enforcement by rounding up drug dealers and harm reduction programs.
It's not just that we're, going out to the street and handing out people money. It's more like you're in a program. Maybe it's an outpatient program where you're reporting weekly, giving weekly drug tests, so there's some accountability involved with this.
All right, we got to bring it back to who's paying for this. Any other details of how taxpayer dollars specifically would be used through this program?
Yeah, Liz, if SB 110 is signed into law, taxpayer dollars would be used through the state's Medi-Cal program. That serves about 14 million Californians. The bill has passed through the state Senate as well as the Assembly, so now all that's needed is the governor's signature before the bill becomes a law.
All right, Kenny, thank you.